Seacare Health Services is an agency that was created by local physicians in the late 1980s as a response to a call from the Robert Wood Johnson Foundation to have the local physicians in the community come up with a way to provide services to uninsured. And what they did was they went around and said to the physicians in the community, you are already seeing people who are in need. If we were able to create a system where we would make sure that you were seeing, in fact, the neediest folks, and we provided what we call care coordination, the services that those families would need when they find themselves uninsured and maybe in crisis, would you see the folks in your office? And they said that would be perfect. That's exactly what they would love to do. Exeter Hospital has been the most important partner we have at Seacare Health Services. Not only do they provide an extraordinary amount of financial resources. Over the years, it's been over $3 million. Just having them behind us has also been really helpful in leveraging additional funds for the program. If a funder sees as a potential partner for Seacare Exeter Hospital, it makes them more likely to want to provide additional funding to us. That we are a stable group, that we have been looked at by a larger organization like Exeter Hospital and deemed to be of value and deemed to be credible, and it has really helped us in attracting other funds.
May, a year and a half ago, I was in a traumatic, I was violently assaulted, and I came to them a wreck with a pile of medical bills like you wouldn't believe, and a head injury, and I was foggy, and I was sad, and I was post-trauma, and they really sat down with me and, you know, handed me Kleenex, and they said, well, you can take care of this, and they hooked me up with the New Hampshire Victims Assistance Fund, which helped me get those medical bills paid for my head injury and my other injuries that I had. They were terrific at just kind of, they're social workers, you know, so they were great at just listening and helping me get my life back on track after that, because it was hard. It was hard. Here I was thinking I was getting my life back on track, and then I'm deluged with medical bills and head injury stuff. So they connected me with different people so I could get the treatment I needed to pull it together again. They also helped me get my little boy, who was 5 at the time, on New Hampshire Healthy Kids, and they accepted him into the New Hampshire Healthy Kids Silver program, so I was able to get him dental care and medical care and take care of his asthma and just keep my little boy healthy. Because Seacare was so excellent at helping me get my life back on track, now I've got some success under my belt in being able to give back in the community through Cleaning for a Reason, providing free cleanings for cancer patients, and Fair Tide, which I help with donations and cleanings and different things for their homeless people. They are wonderful. I can't speak for other members of the community, but for me, coming from, you know, a hardworking professional position and then having nothing, it was horrible. It was traumatic, and it was scary for me, and it was scary as a single mom for my children to know that, you know, I'm the primary breadwinner and all of a sudden we have nothing coming in. That was scary. And Seacare brought balance to my life, you know, and knowing that there were counselors if I needed counselors, or medical care for my children and I. It was just an amazing relief not to have to worry so much about that piece of it.